What hysterectomy options are there for cervical cancer? When it comes to treating cervical cancer, surgery can be a key part of the plan. One common surgical option is a hysterectomy, which involves removing the uterus. But not all hysterectomies are the same, and the choice depends on how advanced the cancer is, the size of the tumor, and the patient's overall health and fertility goals. The simplest type is the simple hysterectomy. This procedure removes just the uterus and the cervix, leaving surrounding tissues like the ligaments and vaginal tissue intact. Usually, the ovaries are left in place unless there's another reason to remove them. This approach is often used for very early-stage cervical cancer or for severe precancerous changes. It can be done through an abdominal incision, through the vagina, or minimally invasively with laparoscopy or robotic assistance. For more invasive cases, a radical hysterectomy is typically performed. This surgery removes the uterus, cervix, part of the upper vagina, and a wider area of surrounding tissues, including ligaments that support the uterus. Often, nearby lymph nodes are also removed to check for cancer spread. Sometimes, the ovaries and fallopian tubes are taken out as well. This type of hysterectomy is usually recommended for invasive cervical cancer that is less than 4 centimeters in size. It is more complex and may requiring a longer recovery, often involving a temporary bladder catheter after surgery. There is also a modified radical hysterectomy, which is similar but removes less tissue than the full radical version. It might be suitable for certain cases where the tumor is small and has not spread extensively. This approach aims to balance effective cancer control with preserving as much normal tissue as possible. In some situations, especially for women who want to keep their fertility, other surgical options are available. A radical trachelectomy removes just the cervix and surrounding tissues but leaves the uterus intact, offering a chance for future pregnancy. Cervical conization involves removing a cone-shaped section of the cervix and is often used for very early cancers or precancerous lesions. The method used to perform the hysterectomy can vary. An abdominal hysterectomy involves a larger incision in the abdomen. A vaginal hysterectomy removes the uterus through the vagina, avoiding abdominal incisions. Laparoscopic and robotic-assisted surgeries are minimally invasive options, using small incisions and cameras for precision. Choosing the right hysterectomy depends on many factors, including the stage of the cancer, tumor size, the patient's overall health, and whether they wish to preserve fertility. For invasive cancers, a radical hysterectomy with pelvic lymph node removal is often recommended. For very early-stage disease, a simple hysterectomy might be enough. Fertility-preserving options are available but requiring careful evaluation and are suitable only for select patients. It's important to remember that surgical decisions should always be made in close consultation with a gynecologic oncologist. They can help weigh the benefits and risks, considering the individual's cancer stage and personal goals. Postoperative treatments like radiation or chemotherapy may also be part of the overall management plan depending on what is found during surgery. Always seek personalized advice from healthcare professionals to determine the best approach for each unique situation.